The following program contains graphic images that may be disturbing. Parents are advised that these images may not be suitable for young children.
Our next guest thought she just had an irritating pimple on her nose until it turned out to be something much, much worse. Take a look at her story.
The summer of 2016, great summer, was playing volleyball, working as a model, hanging out with friends, traveling, and then August I noticed this small little lesion, almost like pimple-like, right on the side of my nose. It started bleeding, and then it scabbed, and then it would go away. So I didn't think anything of it, and then it came back. There was something in my gut that said, like, you need to go get it checked out. I asked the dermatologist if he would do a biopsy on it. I got a phone call, and he said to me, "You have cancer." I had a basal cell carcinoma. I was like, what is going on? Is this for real? So I went in for my Mohs surgery with my dermatologist. I thought this was gonna be a quick fix, go in, have a few stitches, but it wasn't. It got to a certain point where he said, this is way worse than I had imagined, and I have to refer you out to a surgeon. He gave me a mirror, and I had a hole in my face. We found Dr. Kian Karimi. He got me in that next day and said, we'll take it slow. We'll take a conservative approach. For about 2 weeks, I was in and out of the doctors, getting layer by layer cut out. It was very deep. It was growing longer and wider. The first time I saw my face, I took off the bandage and almost passed out.
Normal face, not so normal face.
When you see your face like that, I thought, they're never gonna get this cancer out. They're never gonna be able to fix this. I'm going to be disfigured. I was terrified.
Kaylin's plastic surgeon, Dr. Kian Karimi, is joining us today. And Doc, I mean, I know nasal reconstruction can be really, really difficult, challenging. This looks like it was a really complex case.
Like you said, nasal reconstruction is always very challenging, but this was the most complex case I'd ever encountered.
You know, people don't realize the nose is more just what you can see. It's the internal structure that supports it, the lining that serves a function. So when you undertake these cases, a lot more to it than meets the eye. Who's ready to see Kaylin? Yeah. Kaylin, come on out. Welcome, Kaylin.
Thank you.
I know that your treatment was really involved and that it not only had a big physical effect on you, but also an emotional one.
Absolutely. You know, that was a very dark and traumatic period of my life. Dr. Karimi saw me at my worst, and here I am at my best, but I definitely learned a lot about myself. I was, you know, terrified, but I learned through this experience that I'm strong, I am resilient, and I am brave. And I think that was the biggest lesson.
And I think, Kaylin, for you, I think so many people tend to dismiss skin cancer as something just so easy, oh, I'll just burn it off, it gets neglected, it often gets long delayed in diagnosis. But I think in your case, it's an incredible example of how, while you might see just a little pinpoint at the surface, there's incredible spread underneath. It's often the tip of the iceberg. And so the type you had, which was an infiltrative basal cell carcinoma, as I understand it, actually the most common type of cancer of any type in the United States. But people don't really give it the same attention, often really shocking in terms of the roots and the extension. So Dr. Karimi, tell us about the multiple surgeries Kaylin had.
Sure. So like you mentioned, Kaylin's basal cell was a more aggressive subset, and it actually penetrated all the way into her nose. So it had gone full thickness through her nose. So the first step was to clear the cancer. That's always the priority. So it actually took multiple attempts to clear the cancer, taking different layers. And it was actually a 3-layer closure. We actually had to rotate tissues from the inside to recreate the lining. Then we took cartilage from her ear to recreate the scaffolding of the nose so that it won't collapse with breathing. And then finally, we did a connected flap called a nasolabial flap to connect the tissue. And that actually had to stay connected for 3 weeks. So that was a very difficult transitional time where you have a very obvious thing having that done to your face. And then 3 weeks later, once that tissue gets its own blood supply, we were able to disconnect it from the rest of the face. And then it required some management of the scars as well, which we did with some lasers and PRF and those types of things to get to where we're at today. So it was a very difficult journey, but Kaylin was so resilient and I was just so inspired by her strength for something that was really very distressing for her, for me, for everybody involved.
And to take a step backwards, you had this thing going on your nose for a while, and your primary care doctor took a look at it, and unfortunately, no one did the number one thing that we're trained to do, make a diagnosis. What is this thing? And you look at you and you don't look like you have a ton of sun damage, you're young, that you don't look like the typical person that would have skin cancer, but that's the point. Skin cancer can develop on anybody.
On anybody, yeah, and especially people like African Americans will think they can't get skin cancer. It literally can happen to anyone, and sunscreen is for everybody, and in those protective measures. But Dr. Batra, what are some of the warning signs of skin cancer?
So interestingly, I think a lot of people are familiar with the ABCDs and dark and discolored spots, but actually it's much, much more common to have what Kaylin had, which is a basal cell carcinoma. And in this case, what you always are looking for is a sore or a pimple that doesn't heal, that might be there for a month or more, something that continues to scale, something that just continues to grow insidiously and never quite resolves. So I tell my patients anything pearly or pink that's been there for more than a month should be evaluated.
And not just on your face, right? I think you should pay attention to your entire body, including your genital region. So skin cancer can develop anywhere.
Absolutely. In fact, interestingly, when they come from in the genital region, sometimes they're related to HPV. So people who have a history of genital warts and then get a scaly red rash in the groin area, again, if it's persistent, please have it checked.
Yes.
Well, Kaylin, thank you for sharing our story. A lot to learn from this for everybody watching. And Dr. Karimi, great job, great work, challenging case.